Hey, Nadia.
Hello. Hi, everybody.
Hi, everybody. It's funny because we're about to talk about something medical related, and I can hear the ambulance in the background of your apartment.
Yeah, well, that's a hourly occurrence. We live very close to many, many hospitals, so it's
Yeah.
always
So,
hap-
I mean, on a side note, I'm thinking it must be interesting to have to live in a place where you hear ambulances pass by every time, every hour, because you know that somebody has an emergency. Every hour you're thinking about who's in that ambulance. Are you?
honestly, like, I'm kind of desensitized to it a little bit. I hear it so often, like, I don't know. I mean, like, usually when I see an ambulance, I'm thinking about it, but like, I can't see it, I can only hear it. So it just feels like background. Like, it's just something that happens in the background, Like, I don't know, like birds chirping, Like it's just like something that
Oh,
happens outside of my apartment, which I mean, I guess is not the greatest thing, but I guess we can be glad that people are getting the help that they need. But like if I see an ambulance, obviously I'm like, kind of curious and hoping that the person inside is okay. But like if I don't see it, like it's not necessarily, at the forefront of my mind. There are some times where there's ambulances that come to the apartment complex that's across the street from me. I don't know if it's like, I don't know what the situation is with the housing over there. It's not, it's like it's separate from like my like apartment building and the other apartments that are on my side of the street. It's like one big building with a lot of apartments in it. And there's frequently like fire trucks or not fire trucks, maybe police cars or ambulances. I mean, I guess I say frequently, but, you know, not like every day.
is it a place
So
where a lot of
it's,
older people live?
I don't know if it's that or if it's like, there does seem like to be like there's families there. Could also be like low income housing. So there's probably maybe people of like all different sorts of things going on. I think that sometimes it's not always like health related. Maybe like I've heard, I don't know. I'm not
Like
quite sure,
domestic?
but not domestic.
Yes.
I don't really know, but I guess that would be an explanation for it. I don't really know, but they're there frequently. So I hear all the time is what I'm trying to say.
So you're originally from a relatively quiet suburban neighborhood that is
Mhm.
about a mile and a half from the freeway. So sometimes you can hear the freeway if we open up the windows. And we live near like a tennis court. So then
Mhm.
you can see a lot of cars passing by, people coming into our neighborhood to play tennis. But for the most part, that's about as busy of an action you get in our neighborhood. And have you noticed any difference in the way you settle into your bedroom? Like, do you feel any less peaceful or calm living in the city? Or are you pretty, like, kind of desensitized to that and actually very highly, like, do you have a high tolerance for city noise?
I definitely have a high tolerance for it, but I don't know if it's just like noise in general. I'm a pretty like heavy sleeper, or maybe not a heavy sleeper, but like I can sleep through like loud noises, bright lights. Like I don't need it to be like perfectly like pitch black and extremely quiet to go to bed. So I didn't mind it to begin with. I think like maybe in the same way that we always hear like planes going over our house, like that's how I feel about like sirens
Oh,
and things like that.
it's
But
true. We do have planes.
I mean, that's like not that frequently, or I guess like not that loud where it's like disturbing me, and it's also happened like my entire life, so I don't really pay attention to it too much. Just how I feel about the sirens. But I also am just the type of person that kind of needs background noise to focus, which I guess doesn't really quite make sense, but I feel like for me personally, sometimes like extreme like silence like is worse. I don't know. I like my mind is always like doing 10 million things at once. So sometimes if I just have background noise, like music, for example, when I'm studying, like it can help me lock in a little bit more, which I know is like the exact opposite for some people. So I think I'm just like, I like having noise or just like things to occupy the background. I don't know.
Yeah, I wonder what that's about. Like, I wonder if you can make more generalizations about somebody who needs noise in the background versus not. Speaking of noise, can you hear the airplane passing by outside in where I
I
am?
don't think so. No.
Anyway, that's not what I meant to talk to you about today. Today, I wanted to talk to you about how it feels for different people to interact with healthcare professionals. It's inspired by a post that I saw on my Instagram. I feel like a lot of times our conversations are about either something I saw on Instagram or some book that I'm reading. But anyway, it was a woman reflecting on her experience as a student or a resident. Maybe she was in her fourth year of medical school and she
Mhm.
was with another physician, and the patient came in complaining of back pain. Or I guess that's even the words are funny, complaining of. Let's just say, and that's how you chart it, right? Complaining of back
Mhm.
pain, but the person came in describing her discomfort of back pain, and
Mhm.
um, a neurosurgeon came in and left and said, you're this is not a neurosurgical issue," which was probably valid, but she
Mhm.
didn't like heard. And on top of that, to top it all off, he left saying, "And
Mhm.
you're wearing high heels, which means you must not have that bad of back pain."
Mhm.
And then upon reflection, the the medical student was
Mhm.
saying, "Maybe this woman was dressed up nicely in an effort to make sure that she would get treated seriously at the doctor's office. And if the woman had come in wearing like sweats or something, she might not have looked like she took good care of herself. And so she wore a
Yeah.
nice dress and wore heels." So, what do you think about that? Like, you
I
going
feel
into the
like
medical field, like you've
yeah.
worked at the front office, like, have you made those assumptions about people?
I feel like that definitely could be a reason for it, you know? Like she wants to be taken seriously, so she's gonna put on her more or go to the office wearing her more professional clothing. But it also could just be like, people are just really busy and so they're always a lot of times when I was working the front desk, like people are squeezing in these appointments during like work schedules. So, she could have also just needed to come at that time because like she came right from work or I don't know the situation. But I mean, yeah, it's hard not to make those assumptions, I think, because it's like first impression. So your brain is going to do these things without you even realizing it sometimes. And I mean, it was a little bit different for me. Well, not different, actually. I think before working at a community health center, I saw a wide range of people, a wide range of like a population of Boston, especially in the city that I was in, because there's a lot of like post grads, but then also families or families that live a long time, but then also a low income population, all in this like small outpatient clinic. So, I mean, you can definitely like make certain assumptions based off the way people dress, but a lot of the times I don't know, we were kind of talking about before about like my visits to the doctor's office, and I feel like I sometimes like avoid it or like not avoid it, but like haven't gone in a while. So I feel like going to the doctor's office sometimes feels like a burden to some people, or just like feels like there's not enough time. So, you know, wearing like your work clothes could just signify like, you know, okay, I finally made the time to come. So hopefully I get an answer in this like short 15-minute appointment. And maybe she wasn't really thinking about like how the doctor would perceive her. I don't know. But I don't know, just about anyone can come in wearing sweats, especially if they're not feeling well. So I don't know
Mhm.
if that's, I don't know. I'm not quite
Well, she
sure
happened
if,
to be this post was a the doctor that was reflecting on it was describing a patient who happened to be African American, and she's
Mhm.
wondering if this woman felt I mean, she can't ask her at this point, right? But she reflected upon it and she's like, "Huh, I wonder if this woman felt like she had to overcompensate to make herself look like someone to be taken seriously because she's had experiences where she wasn't taken seriously."
Yeah.
And that
I mean,
for
yeah.
sure has happened to me.
I mean, wait, you can explain, but I was just gonna say that, I mean, like, I can't personally speak on, like, African Americans woman's experience in a doctor's office. So, like, I could say, like, oh, maybe that, like, I don't really think that she was, like, dressing that way so she could be taken seriously, but maybe she really was. And, she has, like, a history of not being, not getting the care that she needs. So,
I guess my story, you were part of this story. And I don't know if we've talked about it on this podcast, but I what I reflect on in this experience that I'm about to describe is a little bit about the healthcare provider, but more about like what was going on in my head and being like kind of cognizant of that and thinking about how I might be creating these types of situations for people also. So, what happened was you were 9 years old and you were in dance and gymnastics and you had glasses. You required glasses to see far away. And there was no way to really do gymnastics safely without wearing glasses. And
mhm,
I thought that it would be appropriate for you to wear contact lenses just while doing gymnastics and maybe performing for dance. And where we go for healthcare services, at the time, apparently they had like a standard age that you would introduce contact lenses. And for good reason, right? Because if you wear contact lenses for too many hours, then you might, cause damage to your eye. If you do that for too many hours times so many more years, like starting at age 9 versus starting at age whatever, 12 or something. I
mhm,
don't know what the cutoff age was, then that's even more years. And then on top of that, if you're young and not very responsible about keeping your hands clean, keeping your contact lenses clean, having the coordination to like put something in your eye without poking your eye with a fingernail or something, that can be an issue and cause damage to your eye, right? So I think that's what the policy is there for. But anyway, when we walked into your contact lens appointment, and actually, weirdly, I just got like butterflies thinking about it because I can picture the
mhm,
whole situation in my mind. I had you next to me, and I'm almost 49 years old, and this is what I look like. So you can only imagine what I looked like, how many years ago was that now? You were 9. So 11, 12 years ago, right? Look young and I'm short. I'm under 5 feet tall, which automatically makes me look younger.
mhm,
And I was smaller, even smaller, like skinnier, right? So I looked like a young mom. And I walk in with my 9-year-old kid and I want to get her contact lenses. And I have this like feeling that this woman who's definitely older than me, she must have been like early 50s. I had this feeling right upon meeting her that she was judging me for bringing in my 9-year-old daughter. And
mhm,
when we came in, she probably looked at your chart and saw that you were 9 years old. And she was working at the optometry department, contact lens fitter. We had already gotten like a referral from the optometrist, but she, as a contact lens fitter, was like the she's like the last barrier to your contact lenses, right? And she had this private little office. She opened the door. She's the only one in the office. And the first thing she says to me is, "Oh, well, your eyes look tired like you've been wearing contact lenses," or something like that. Words like that. She was
uh-huh,
like judging my eyeballs, right? And I was like, "Oh, yes, I wear contact lenses." But I
yeah,
wasn't really sure how to respond to that. But immediately I felt defensive. And I made some assumptions about what she's thinking about me, because it's not like the first time I was judged for
mhm,
being like mom, right? I had you 27 and I already look kind of young, so blah, blah, blah. Anyway, so then we sit in the office, and I think you could feel the tension too. Plus, you're nervous and you tend to be like a kind of nervous person, like you
Mhm.
when you know that breaking the rules or whatever. And I don't know. It ended up being like a disaster in that I think you might have been crying. You couldn't get the contact lenses on. The woman went into this long speech about how, something about it not being responsible, having a young kid wearing. Oh, I remember what she said. She turned to
Mhm.
you and said, "Is it you who wants contact lenses or is it your mom?"
Oh,
And,
wow.
like, you can imagine 9-year-old Nadia. What am I supposed to answer here? Like, you
Yeah.
knew what you wanted to answer, and you kind of wanted contact lenses, but then you're like, "But it's my mom's the one that came up with this idea,
Yeah.
but I'm okay with it too, but, like, I guess this woman is telling me that I shouldn't want contact lenses?" I don't know.
Yeah.
So that happened, and then in the whole process, what I noticed about myself was I
Mhm.
felt like I had to give myself credibility. Like I
Yeah.
kept talking to this lady about stupid stuff that was irrelevant that kind of
Mhm.
made her know that I was educated,
Ye
that I don't know, that I didn't care just about how you looked. I don't know. I don't know how else to say
yeah.
it. I think about it, it's so dumb. I think I saw
Mhm.
like thing on her computer and I was like, "Oh," something like, "Oh, I love going snowboarding." Like trying to show her that like I have education, that I do fancy things. I don't know, so dumb. I'm
Yeah.
embarrassed thinking about it. And then but I was ultimately really pissed about the whole experience
Yeah.
and immediately took you out of that office and brought you straight to
Lens
another place at the
crafters.
mall. Hmm?
Yeah. Lens crafters.
Lens crafters. Brought you to lens crafters, and I told the guy, I said, "I don't care if she gets contact lenses at this point. I just need for her to have a positive experience because we just had a really negative experience at Kaiser." And
Mhm.
so turns out when you have a supportive person helping you, a 9-year old Nadia was able to get her contact lenses on.
Yeah. I mean, like,
And
it's crazy because it's not just 9-year-olds that have difficulty putting these in. I have, like, friends who have I don't know, like, upon getting first their contacts for the first time takes them, like, at least 30 minutes. So it's not just, like, kids that have trouble doing these things, it's adults too. And I mean, like, I didn't know all the details of that story, but, like, some people I feel like just aren't meant to be healthcare providers. Like, I think at a certain point, like, I don't know. That's just crazy. But yeah,
yeah, like,
support
are you
helps.
here to help the patient or are you here to gatekeep? Like, what is this your
Yeah.
sense of power?
But I'm
Like,
also like, I don't quite not quite sure what you gain from not giving me the contact lessons because that is her job. That was her job. You know, like,
well, yeah. So here's the thing. I mean, if I'm going to give her the benefit of the doubt, she was protecting you from future eye problems, and she was basically advocating for the poor child whose mom is pressuring her to wear contact lenses so
mhm,
that she look prettier or something like that. And the lens
yeah.
crafter people benefit from selling. So they are compelled to get you to get the contact lenses on because they want to sell you some contact lenses.
Yeah, I know,
Right.
but like, I don't know. There's like so many different ways to go about that. And at the end of the day, like, a content lens fitter was just like a small part of the process. Like, we'd already gone through so many steps. So, like, not quite sure why she needed a power trip at that specific moment. But yeah,
Yeah.
it's like a weird
Maybe she was
position to
having a
put a
bad
kid
day.
in. I just honestly think that sometimes people are not quite meant, maybe not quite meant to be healthcare providers, but like, you know, are not quite suited to be working with like face to face with patients.
Yeah. Yeah. That was my biggest like memory of like feeling like I needed to act a certain way to impress the healthcare provider so that I granted whatever healthcare that they could give me. But I've had
Yeah.
some weird healthcare interactions for sure. Have you? Do you feel like you have?
Not really, but like I said, like, I honestly don't feel like I've been to the doctor that much, especially, like, in college. Like, I've been for, like, physicals, I've been when I got an IUD, like, I guess I'm going to the doctor so I can check my eyesight, like, because my prescription is expiring, like, it's just, like, very small things, like, and I've never well, knock on wood, I haven't gone, like, in the past for something, like, super crazy where I, like, needed or where I really thought I needed, like, a healthcare provider's perspective on something, you know? So, like, it's all been pretty low stakes. I mean, apart from the IUD, but I just have a good experience getting it at the place that I did in Boston. But yeah. So not really, but I definitely learned a lot about it and
Oh,
I don't
tell me what
know.
you learned about it in school. Like, because that was actually my next question. Like, how are you going to be the kind of care provider, healthcare provider that is the one that should be client or
Yeah.
patient facing? You know, like,
I mean, like I definitely don't learn about it in my like pre-med classes, like the sciencey STEM classes, but I definitely have talked a lot about it in my public health classes. I think we talk a lot about, you know, healthcare disparities, like prejudice that might or implicit bias that might come into play in the healthcare system and why I guess things that stand out to me, I feel like I'm not remembering exactly everything, but things that stand out to me are like having the importance of cultural representation in healthcare or providing culturally relevant care to patients. And I guess like that can be for like someone's race or ethnicity, but also gender. And we learn a lot about, I had a specific, I think I've talked about this on the podcast was my health communication or yeah, health communications class, like best ways, or I guess not the best ways, but like, learning how to communicate health related topics in the most effective fashion to like many different types of people. But like, especially when thinking about like all like healthcare, like disparities in healthcare and all of that, I don't know, it's clear that there are unfortunately, like biases that are held by providers consciously or unconsciously that can affect the quality of care that patients receive, what kind of care they receive, like what resources they're given, and even sometimes like how results are interpreted because, like research studies aren't necessarily, or past previous research studies didn't quite aren't we're not able to extend it to like all different populations and it's just like that white male population. So I don't know, but we just talked a lot about how important it is to recognize these things and to work to combat those like disparities.
yeah, I mean, I guess that is what they say about bias, right? The first part is to like recognize
Mhm.
you have it and acknowledge it
Right.
and then question it. And then I guess like listen to the patient, really try to listen and try to
Mhm.
think effective as much as you can and realize that the way that you think about this situation might not be the way that they're thinking about it. So getting
Yeah.
some feedback about like how they're understanding things so that you can see if you guys are still on the same page.
Yeah. And I think, yeah, it's hard because there's a lot of providers that feel that, or like, I guess, well established providers that are used to more traditional ways of doing things or, and then start getting into a certain mindset that like, there's like, I guess like a one size fits all kind of mindset where you're not looking at the patient as an individual or maybe just focusing on like the diagnoses and not their cultural background or other things. So,
Yeah, I'll give you an example. So, because I'm often working with patients with pain. When I first got out of school, there was always using we always were like had to use a visual analog scale. Like, what is your pain on a scale of 0 to 10, right? 0 being no pain at all, 10 being the worst pain you've ever felt, right? And there were times that patients would say that they have 9 out of 10 pain or 10 out of 10 pain.
Mhm.
And meanwhile, even though that they said that they have 10 out of 10 back pain, they like, for example, reach down to the ground and like pick up something from their purse. And in my mind, I might be thinking, if I had 10 out of 10 pain, there's no way that I could reach down to my purse and grab
Yeah.
something, my purse on the floor. And so without like recognizing that people have different ways of describing things, you might make some assumptions about this person. Like added on
Mhm.
to the fact about the way that they present, you might be like, this person is lying, or what are they getting out of coming to physical therapy? If this maybe this is a workers' comp case and like they're trying to
Yeah.
get out of work and that's why they're saying that. But you come to realize that like sometimes people when people are saying 10 out of 10 pain, they mean to say not like I'm dying and I can't move, but like this is really bothering me. Like,
Yeah.
I can't move. I've taken time out of my day, my very busy day, time out of work when I can't really take time out of work to come here because this is
Yeah.
bothering me a lot. It's an important thing for me.
Yeah.
So, yeah. So like
Yeah.
if you come in with a bias, you might be like,
Yeah.
the person's lying.
Yeah. I don't know if we've talked about this or this is something that I've learned in my classes, but like I guess maybe it's both, but definitely in my classes talked a lot about like the ways in which like medical providers are trained and how sometimes people can be trained to assume that certain ethnicities or certain genders will tend to over exaggerate their pain or whatever. But I think it is in relation to the example I'm thinking of specifically is in relation to like an older Hispanic woman, which like I think that was definitely something that I saw in the community health center that I worked at. I think there was a large Spanish speaking population that came to the health center. And obviously with that, our older Hispanic ladies that are coming into the office and like in pain and all of that. And I think I see them and then I look up back at, what I learned about in my classes and just like hope that, they're being treated seriously because I get like they do like there's sometimes they can come more often or like you'll hear people say like, oh, this is just someone that comes into the office all the time, like she's always making appointments, like her family's always making appointments for her, and so it kind of like diminishes maybe the pain that she's experiencing. And and like sometimes these thoughts are maybe not taught, but promoted in medical school or residency
Reinforced
or
a little bit in the
yeah,
conversations and
reinforced.
stuff.
Yeah. So yeah, I guess that just goes
I
back
think
to like one size doesn't fit all type of situation. Like that could be a situation for a certain patient, but it definitely doesn't apply to an entire population.
right. And in defense of like those physicians that are taking care of
Hmm.
the different people, and they might know that one size doesn't fit all, but like they're so booked and having to get from person to
Mhm.
person. And then there's all these different check
Yeah,
boxes that they have to
totally.
fill. And they don't have time to be like, oh, 10 out of 10, tell me more about that. Like how's it affecting your day? Like they don't have time. They're like 10 out
Yeah.
of 10, okay, this person's lying, or I mean, I'm not thinking that all the doctors are thinking that, but
Yeah.
like there's not enough time to really get into it. And
Yeah.
that is I don't know. I don't know how to fix that.
Yeah. But I feel like the best providers are the ones that make use of that time. Like sometimes there are patients that just come in because they want to talk to someone about their
Mhm.
pain. Maybe it's not a 10 out of 10 pain, but they just want to talk to someone about it and like have someone hear them out. So like, all you can do is use the time that you have like available to you, especially in a community health center like that where it's just like kind of go, go, go. All they're really looking for is a provider to like listen.
Yeah, and remember on multiple occasions people feeling super expressing a lot of gratitude for being able to speak to me in their native language in Spanish. Because you can just imagine, like, if you have pain and you have to talk about it in
Yeah.
another language, like, I'm not
Yeah.
fluent, like, native speaker, but I understand completely enough to listen to somebody's entire explanation about their pain.
Yeah.
And,
Totally.
and you have been definitely in situations where you're in a country where your language, English, is not the primary language, and it's
Mm.
hard to just, like, constantly be interacting in
Yeah.
that way.
Yeah. And I mean, at that same health center, there were like Spanish translators that would come into the appointments or that could come into the appointments to help out with translation, stuff like that, which is really helpful because, like, I think most offices have like electronics, like iPads and stuff that like they have translators online. But a lot of people really prefer having an actual person there because it makes it more personal. And, you don't want to tell some random person on an iPad, like everything that's going on in your life. But then that also just like makes the appointments even shorter because there's only two translators and you're having to see people on all different floors. And like you would want more translators, but there's no, it's just like, it's a lot, but
Plus everything has to be said twice.
right. I mean, there are, I think, at this health center, there were some providers that were able to speak Spanish, but like you want it to be, you don't want there to be any miscommunications. So knowing another language is always helpful.
I'm just, like, quietly laughing here because I'm wondering if I should tell the story of you and Eric getting
Oh,
healthcare in
no, we
Colombia.
don't need to expose me like this. But it wasn't about me, it was about my dad.
Okay, so we
There was
can
just some miscommunications with, but I think that in this specific situation, like, we both kind of knew Spanish. So, like, there was kind of, I don't know. I guess I don't remember it entirely. But a lot of things can be, like, lost in translation.
Yeah,
And it's
well,
always helpful to
he
have.
thought he had a diagnosis that was totally different than the diagnosis he actually had, and it's because the 2 words sounded really similar.
Yeah. But I feel like with that, what I was trying to say before is, like, maybe, like, we came in with the expectation that we kind of knew like Spanish and could understand basic medical things. So yeah, but I'm not quite sure how the Colombian healthcare system works.
It was actually quite nice. It was really well done, but it was just Eric not totally understanding Spanish as well as
Hmm.
he could.
Yeah.
Or as well as he should for
Mhm.
an appointment without having a translator.
Yeah.
He understood
Yeah.
everything except for the medical diagnosis, and
Mhm.
then that makes sense because, like, when do you learn how to when you're in Spanish 3 honors in high school, you're not like, medical diagnoses is not usually the vocabulary list.
Yeah. Totally. Yeah. Well, more. This is just our push for more culturally sensitive care and access to in person translators in community health centers.
There you go. And maybe you need to learn a few more languages.
Yeah. Well, that might take a while. So, a translator who is natively fluent in that language is always more helpful than me learning on Duolingo.
Yeah. I guess what languages would you learn? Become more fluent in Spanish, and
I
then, like,
think
what's 2 more languages?
it would depend on where I was working. Like, if I was like an actual provider at the health center that I worked at, it was mainly Spanish, Albanian, and Haitian Creole, which is like definitely not representative of all of Boston, but there definitely are a lot of, I guess, like maybe, in my job now, there's a lot of people that speak Spanish there that we interact with. It's mainly people who speak Spanish, Portuguese, and also Creole. But, that might not be the same in California or New York or wherever.
Yeah. I'm thinking here in the Bay Area, it'd be like Vietnamese, Spanish, Mandarin, and I don't know.
Yeah. Yeah. There's some, I don't know. Yeah, I'm not sure. But yeah, definitely Spanish is super helpful as a healthcare provider, or I find it helpful, but I also like those are the types of people that I enjoy working with and have found myself working with. So we'll see.
Oh, Tagalog. You should learn Tagalog.
Yeah. I feel like I don't know. There's a long ways to go, but we'll see.
Maybe you like working with that population because you can actually feel like you can give some good care in their language in a way that some other people can't. When you're
Mhm.
a healthcare provider, you feel like you don't know enough. And so when you feel like you have at least one leg up because you can speak their language, it feels good. And that is how I felt about working with gymnasts and dancers when I first came out of PT school. Like I felt really
Mhm.
good working with the gymnasts and dancers because I love those activities and because I could kind of give betterish care than my coworker who had been working for so many years because I really knew those sports. Like I could to speak their
Mhm.
language. Yeah.
Mhm.
So I liked working with them because I could speak their language.
Yeah. Yeah. It's definitely helpful.
Well, I will let you go. We were going to do a short talk today, but it turns out that we've come up to 40 minutes. It was nice talking to you.
Nice talking to you too. Bye, guys.
Bye, guys.